My name is Brady Kerkman, Executive Director of Marketing and Business Development here at Windom Area Health, and thank you for joining with us, The Pulse, today. Today we have Rhonda Wahl. Hello, Rhonda. How are you?
Hi, I'm good.
Excellent. Well, so tell me a little bit about your role. How long have you been at Windom Area Health?
I have been here almost 6 years.
Okay. And your position here?
I am the Respiratory Therapy Coordinator.
Okay. And what does that entail? What kind of services do you provide patients at Windom Area Health?
On an outpatient level, I do sleep studies and pulmonary rehab and pulmonary function testing.
So let's start with sleep studies. What would be a reason a person would need to come in and get a sleep study?
If they're showing signs of obstructive sleep apnea, snoring would be the biggest indicator of that. Daytime sleepiness, a lot of your comorbidities, other health issues like heart issues. Sometimes your cardiologist or your heart doctor will recommend to have a sleep study done. Sometimes if a person has just a lot of fatigue or tiredness issues, that would be a good indicator. Or if your partner is noticing that you're not breathing when you're sleeping, those are huge indicators for a sleep study.
So a person comes in, you find out that there is some challenges with their sleeping habits. What are some services that you may recommend or may go back to the physician for recommendation?
The physician typically is going to either recommend a home sleep study, which is just a home monitor that you would use to sleep in your home. There are some regulations on if you would qualify for that. If you do not qualify, or if you do the home sleep study and it shows more of a sleep issue that they want to take a better look at, then you would be referred to the in-house or the formal sleep study. And that would be done through Somnitech, which is a contracted company that comes right to Windom Area Health to do the sleep study here.
Okay. And you said you also do have another service line that you oversee. What is that?
The pulmonary rehab program. That would be for anybody that has breathing problems. It's typically going to be your chronic COPD, which is a common indicator, which would be your emphysema or bronchitis, asthma. There are other, outlying lung issues that would bring that to you. And that's a 6-week program, give or take, where people come in and get education on their lung disease, and then they also have exercise time in the wellness center.
So if I'm hearing correctly, then you probably have to work pretty collaboratively with a lot of different specialties, a lot of different departments around Windom Area Health. Would that be a fair assumption?
Yes, I work quite well, I feel, with the providers that we have here locally, and then I also work very closely with pulmonology.
So just to clarify a little bit, as we bring in so many of these different specialties, a lot of times they can refer for, as you said, sleep studies or pulmonology services. So you work very closely with that specialty clinic here as well.
Yes.
Okay. And tell me a little bit, how are your services different maybe than from somebody else in the surrounding communities?
Here at Windom Area Health, we're very lucky that we are able to provide all of those services. A lot of, like the pulmonary rehab, I'm the only location in Southwest Minnesota that does this. So I get referrals from quite a few different facilities to run their clients through pulmonary rehab here locally.
And then other places are as far as sleep studies?
The sleep studies, there are some outlying areas that do the home sleep studies also, but I'm probably one of the bigger areas that will do those. And then we have the Somnitech that comes here also.
So you're kind of a one-stop shop in a sense, in that regard as well.
Yes. I'm very lucky to be able to have the support of the facility to be able to provide those services.
What do you do during your free time then, obviously,
In my free time, then I help with a lot of the patients in-house if I can, or help in the emergency room, help in the nursery.
Well, excellent. Well, if patients need to get a hold of you, how can they contact you?
Patients, a lot of the times it's best to go right through their provider and have the provider contact me. But if patients have any questions at all, they can certainly just call my office, and I'd be more than happy to answer any questions. My number would be the 507-831-0647.
Excellent. Thank you for joining us. We'll see you next time.
Thanks.